Fever, cough, and shortness of breath are the typical symptoms for the coronavirus, but doctors say there is another symptom to keep an eye out for. Joining us now is our doctor, Malika Marshall. And doctor, we're talking about a loss of smell?
That's right. So these were ear, nose, and throat experts in the United Kingdom that discovered that many patients infected with coronavirus report that they're having difficulty smelling. And in fact, in South Korea, about 30% of people with mild cases of coronavirus reported trouble smelling. Now, it's not uncommon to lose your sense of smell when you get an upper respiratory infection, so it's not surprising necessarily that this coronavirus might do the same. People also reported having difficulty with the sense of taste.
And the doctors say this could be an early sign of coronavirus infection.
Yeah, and it's kind of a concern because doctors in regions all over the world have been noticing an uptick in the number of patients that have reported having difficulty smelling. And so the concern is that there might be people out there who really their only symptom is loss of smell, and they might not know that they're infected with coronavirus. They sort of don't meet criteria for isolation or even for testing. So they could be walking around with this lack of smell, infected and infecting other people without even knowing. The other concern is for healthcare workers. So if you're a healthcare worker that's presented with a patient who says they're having trouble smelling, it's probably time to put on your personal protective equipment, assuming you have some, in order to examine that patient and protect yourself.
And if you're at home and you go, I don't have a sense of smell or taste right now, should you call your doctor? Is that the first step you take?
Absolutely. And they may suggest that you isolate yourself for some period of time.
Dr. Malika Marshall, always good to see you, even if it's over the internet now. It's still nice to see your face.
Thanks, Liam. Good to hear your voice.
All right, we'll see you later on. Paula, over to you.
Yeah, we do appreciate Malika.